Thank you, everyone, and good afternoon. Happy Ash Wednesday. Thank you for joining the Power of Pause, the healthy benefits of taking a break. This is presented by Digital Medicine. Um, I am Jessica Daigle. I am on the marketing team for Digital Medicine, along with my co-host, Danielle Bovland. And we're going to take a little bit of your time to talk about taking a break and the benefits that gives you. So, a couple of things. This meeting is being recorded. If you have an issue with that, you can go ahead and sign off, but we can't see your faces or hear anybody. So, and then also it's being recorded because everyone who is registered is going to get an email with the recording sent to them over the next week. We have a Q&A box. If you have some questions, please pop those into the Q&A box. We do encourage audience participation. So, I see people are using the chat box, saying good afternoon and everything. If you have a detail you want to bring up, a comment, then please go ahead and pop it in the chat box. We love the interaction. However, again, if you have a specific question, it's probably better to put that in the Q&A box. So, with that being said, I'm going to introduce our presenter today. Her name is Alicia Dabezies. Alicia is a professional health coach with Ochsner Digital Medicine. She specializes in cardiometabolic conditions. She is national board certified health and wellness coach. And Alicia loves exercise and dogs. So she's going to go ahead and give you some tips here. So, Alicia, go ahead and take it away.
Thank you so much for the introduction, Jess. And I'm sorry I got a little bit ahead of myself. I'm just so excited to be here. That was such a nice introduction. Yes, I'm very happy to be presenting again today. This is actually my second digital medicine presentation. If you attended the presentation last year about gut health, please feel free to put that in the chat. I'm so happy if you decided to join me again, or if this is your first time. So please, I would love to have questions. Throw those in the Q&A box and I'll go ahead and get started. So, of course, this is going to be an interactive presentation. We're talking about today the power of pause, why taking a break from something or abstaining from something for a period of time may have benefits. And so today we're going to talk about the why. What's your motivation for doing this? Then we'll talk about the how, because it's easy to say about, why we want to do something or get, great ideas, but how do you do it? How do you follow through? And lastly, we're going to talk about the who and who can help and what support we have to offer you from Ochsner. So just as a little introduction, this topic is no coincidence. Today, in case if you missed it, we have just completed our Mardi Gras season in New Orleans and Louisiana. But this is something that starts today. Lent is celebrated in particularly predominantly Christian religions and Catholicism. It's just a period of 40 days leading up to Easter. So this is something you do not have to practice for religious reasons. The object of Lent and abstaining is really not to be punitive, but to see what kind of growth and what do you have to gain from giving up something. So this is something, many people have done this before for years and years. It could be a tradition for you, or you could say, going to give this a try, maybe for the first time, but we want to set you up for success for that. And ultimately, why taking a break can be good for you. So why would you be motivated to give up something for the next 40 days? That sounds like such a long time, but when we think about it, we can break it down. We can look at it as part of this month, part of next month. But what motivates you? And that word, we've got that bolded for a reason. There are three particular motivations that I want to address. First is the motivation for self-improvement, for self-betterment. Again, going back to like that personal growth, how can you grow, or where do you want to be in the next 40 days? How are you going to grow over this length of time? Ultimately, the time is going to pass anyways. So how are you going to use your time? Are you going to be better off or in the same place? So only you can decide that. Next is motivated by your tradition, religious reasons, spiritual reasons, of course. That is a big part of our lives. But yeah, if that is a big part of your life, that's a good motivation for doing this. And then lastly, motivated by your health, wanting to improve your health, wanting to improve your biometric markers. You can see a big difference after 40 days, and we'll talk about that a little bit more later on. But if any of those reasons resonate with you, please share in the chat box. What would you be motivated? Why would you be motivated to give up something or practice abstinence from something for the next 40 days? And now after we talk about the why, let's talk about the what. What are you giving up? So it could be something you've given up before in the past. You could do the same thing every year. Could be something new every year, but answer in the chat box. I'll give us a little bit of time to do that. Have you decided to give something up yet? You may still be contemplating it, may still be thinking about what would actually have the most payoff in the next 40 days, what can really make, the most difference. And being a health coach for the past 4 years, I have seen some reoccurring topics, like particularly, I've seen a lot of people want to give up fried food. Not saying that you have to give it up, of course, forever, but just for 40 days, giving up fried food, particularly like fast food. Another popular one is sugar or bread, probably because we've all had a little too much king cake over the past few weeks. Third, I would say that we do see a lot of people who choose to give up alcohol for 40 days. Either they're a part of a challenge or they want to see what health benefits they may gain from that. And then lastly, not food or beverage related, but technology, social media, excessive cell phone use or gaming, tech. So that kind of arena is what we also see a lot of. Des, are you seeing anything
Yeah,
in the
Alicia, I
chat?
just wanted to go back to when when you asked why people were giving it up. Tia says, my health, my family, emotional well-being. So that's good. Most people are saying they're motivated to get healthier. My health is a big motivation, better health. Carol wants to set an example for her family.
Wow.
And then, of course, with the answer in the chat about what they're giving up, a lot of it has to do with food, giving up bad food. Someone wants some help with focus and attention span. Someone wants to save money. Someone's giving up processed sugars, sweets. And then we've got a few things for social media. People are giving up that social media. I don't know if they're doing it for the 40 days or if they're going to try to do it all year or whatever. Chocolate, alcohol. I personally, I give up meat for 40 days every year. That's not so much for religious reasons, but it's just kind of for ethical reasons. Um, uh, Tung Nguyen says, I think fried chicken got to go for 40 days. Yes, that's me. I say bye to the fried chicken. It's one of the hardest things for me not to eat. And then we've got some other things like frivolous spending. Someone wants to get rid of clutter. Yeah, so oh, here's one, giving up negativity and trying to be more patient. That's a good one, Paige. So yeah, we've got a lot of different things that people are giving up here.
This is wonderful. I'm so glad that we're all on the same page. Everybody here is wanting to better themselves, whether it is through giving up something to better your health, whether that's your physical health or your mental health, emotional health. So we are just all about to talk about that. Of course, you probably can already think of some benefits, but today, ultimately, what do you have to gain from giving up? So the first thing we'll talk about, your mind, your mental clarity, giving yourself the opportunity to remove distractions. So, secondly, your body, your physical health, improved health markers, biometric markers, those benefits from giving up. And then lastly, it's your soul. It is your personal or spiritual growth and your self development, self-improvement, of course, also maybe financially, you're going to be better off in 40 days. So the first thing we're going to talk about as a huge benefit is your self-control and discipline. And this is a quote that actually I couldn't even find the person who originally stated this quote, that self-discipline is the highest form of self-care. This was said by several people, but that self-discipline is the highest form of self-care. And I think what that translates into is that you're putting something to the side or putting something away so that you can have something better. And that is hard to do. It's not instant gratification, it's a delayed gratification. So taking a break from something, whatever it is that you're choosing, it's going to require your willpower, your determination, and your decision. So this is going to strengthen your self-discipline over time. It's going to be easier in 40 days from now to say no thank you, or not right now, I'm taking a break. It's probably not that easy today, but in 40 days, it certainly will be if you stick with this. So just like it takes time to develop a new habit, it can take some time to unlearn a habit that's already established, an old habit. So, you're going to learn patience with yourself and grace with yourself over 40 days. In the examples that we have listed here, you actually will crave more of what you give yourself. Whether that is a good or bad thing, you're going to crave more of whatever you give to yourself, like giving up sugars or sweets, chocolate. I heard that. Oh man, I get it though. The less you have of it, the less you're going to want to crave it. And then number 2 are stepping away from excessive phone use, playing games on the phone, video games, things like that are that could be time otherwise or better spent. You're going to reset and reduce your dependence on those things. You'll start to miss it less and less. Again, maybe not on the first day or the second or third, but by day 40 and even 41, 42, you'll see that difference. So first is better self-control and self-discipline. And next, the benefit of just clearer thinking, having that mental clarity. So how this helps is, well, we already did all that. Okay. Mental clarity. I need some mental clarity on my mouse to not use the scroller to go up and down. But how this helps is that self-reflection. It actually happens when you step away from these distractions. This allows you time and space to think about what truly matters and what is affecting your life, be that positively or negatively. And because of that self-reflection, you can have a fresh perspective when you distance yourself from something. And often you may appreciate it more when you come back or when you have a return, but this practice is going to promote mindfulness. And so along with this mental clarity, clear thinking, we've talked about the benefit of taking a break from social media, like somebody has already mentioned they may be doing that. It takes, it will enable you to have more concentration, more bandwidth is the word we like to use for that. You have the bandwidth to concentrate, take on more important tasks or creative projects even. So starting by maybe spending the weekend without your phone could lead to less tech dependency, finding a more balanced approach to your tech use. And lastly, so fasting, of course, that's a huge theme in Lent and giving something up for 40 days, abstinence. So fasting can really make you more aware of how food or specific foods affect your body, maybe how they affect your mind, and teaching, just more appreciation for how you nourish yourself and how you fuel yourself. So those are the first two benefits. And lastly, we've kind of already touched on it, but very importantly, your biological, physical health perks. And I like to think about this about like, think back to a time, the last time you felt really well, like really energized, really healthy. And I think about, if you're here and you want to put in the chat box, does anybody have kids? Does anybody have children? And think to themselves, like, where does this energy come from that they have? Okay, but while that is kind of silly, we think about that. And so besides being a child or being a kid, during that time in our younger lives, we had probably some things, our lives were a little different than they are now. Maybe we got more sleep. Maybe we had someone helping us make good dietary choices, less stress, and we didn't have the opportunity to have those indulgences like, alcohol or free reins on our diet. So I think about that when we talk about abstinence, we talk about Lent, what you're giving up, your energy. I can't think of anybody who doesn't want more energy. So that's a huge physical health perk. I was so surprised that when I was researching this topic, particularly about giving yourself a month, I didn't see anything really specifically like for 40 days published, but for 30 days, taking a month-long break from alcohol shows improvements, like statistically significant improvements in insulin resistance, body weight, blood pressure, and cancer-related growth factors. So arguably, you have nothing to lose and everything to gain from giving this up, even if it's just for 30 days. That's what the research showed us. And then in other examples, skipping alcohol, skipping or caffeine for a few weeks can boost your energy, support your liver and kidney functions. Similarly, like if you're taking a break from overly fried foods, overly sugared foods, and salty foods. So does any of this resonate with anybody? Is there one benefit you're looking for more than another? You can put that in the chat. I'm curious if people want more of the mind and soul, clearer thinking, boosted productivity benefits, or if it's physical health benefits. A lot of people said that was your motivation, so that's what maybe you're looking to get out of this. And if you see any responses, or if anybody is sharing, I would love to know that. I'd love to know what you guys are looking forward to in 40 days from now.
We do have some shares here, Alicia. For me personally, anything that I can do that would give me more energy would be fantastic. Someone here says less responsibilities, mental health, physical health benefits, spending more time in nature to help with mental health, mental clarity. So a lot of this seems to be even more so far than the physical health benefits is the mental clarity.
Yeah,
Feeling better
all
is a
together.
motivator, focus, financial improvement. Yeah, we have a few more physical health things coming up here, but it looks like the bulk of people who just responded to your question are saying mental health and mental clarity.
Wow, that is amazing. I love that so much. You're in it for the right reasons. And talking about that, going back to productivity. And so my question here, like everyone has said, my question is, who wants more of your own time? Like really, who wants you want your time back? You want more of your own time, reducing and eliminating these time-consuming habits or distractions, and give you your time and your energy for things that are a priority, things that really matter for you. Ultimately, we all make choices. We're all the captain of our own ship. and we make time for things that are a priority. So you have to budget your time in the day. And by giving up something for 40 days, you're giving some, more budget to something else. You're giving up a piece of the budget for one thing, but giving it to something else. I'm so excited. I love that this presentation actually fell the week before daylight savings time starts, however you feel about it. We are going to get an extra hour back in the day of that daylight. Somebody said they want to be connected to nature, and those days are coming. So that's one thing. Think about getting your time back. What you can do with that time is staggering to read the statistics about our adult screen time. And I don't know if you have, you can like put it in the chat. Have you ever actually checked your own screen time on your cell phone, not like our work screen time, which we all have and is important. However, your personal self-use for cell phones, tablets, things like that. Has anybody ever checked that before? And were you personally offended by the number that you saw? Because I will raise my hand. This is me. I have been personally offended by my screen time number, but you don't know what you don't know. That awareness is healthy. And I want to share that statistically, it was on more than one website. Statistically, average Americans are spending 6 to 7 hours a day. That's another job. That's like almost another full-time job on cell phones, using it for social media, checking our email, just, you can, kind of allocate it however you want to, but 6 to 7 hours a day on screen time. And as a demonstration right now, I did look it up. And if you want to check your own screen time, if you have an Android phone, you're going to check under your settings. Well, if you have an Android or Apple phone, you're going to settings. For Android phones, you're going to your digital well-being setting. That's what it said when I looked it up. Digital well-being. I like that phrasing. And then for Apple phones, your setting is going to be like a little purple hourglass icon that says screen time. So I saw some people had their hand raised. I feel like we're being transparent here with our screen time. Any comments about that or notes from that? Did anybody say anything in the chat?
Yeah, there are a lot of comments about it. A lot of people are actually saying that they are not happy with their screen time. Jessica says, I don't find it to be accurate because she listens to music and audiobooks 7 hours a day. So yeah, I mean, I would think
that's a good.
there's some things that you can use your phone for that are better than others,
Yeah.
It's just the kind of mindlessly scrolling that really wastes, like you kind of waste your time, right? But yeah, a lot of people are saying that some people have said that once they gave up social media or at least took it off their phones, that helped a lot. One person says never check screen time on phones. So many use the phone for communication, work, and personal. Again, a big difference deleting social media. Angel says she checked hers and she was so ashamed. But don't be ashamed. It's okay.
I've been there too, Angel. It's okay. We're growing from it.
And then some people are saying they get the notifications every Sunday with their screen time.
Yep.
So
yeah.
But yeah, we've got a lot of comments about this. So the Stacy says, I like receiving the screen time notices. It has helped me reduce my screen time. So I think what those notices are for, right?
Definitely. That's a huge benefit. And I'm glad that you mentioned that too, about the notifications. You can turn that, I'm sure you can turn that off and on your phone if you want to be, if you want to be notified about it. But also, I think you can break it down by like social, books, audio, like music. Maybe some phones do that, some phones don't. I think maybe the Apple phones for sure do. I'm sure
Yeah.
they all do.
Yeah. One other thing to point out, Candace in the chat here says Android allows you to set a timer for specific apps you use more frequently. So if you want to like set a 20-minute, timer for, your Facebook app, to where it'll kick you out after 20 minutes, that is a possibility too. She says Android specifically, but I'm sure there's a way to do that with Apple phones as well.
Yeah, you definitely can. I know you definitely can do that on Apple too. So productivity, huge benefit from giving up or abstaining from, particularly we're talking here about social media, but for a length of time, your 30 days, 40 days, however long. And then another huge benefit that you guys have mentioned is financial. What do you have to actually gain from giving something up? You can translate that into, dollar bills. We pay the price for certain habits and certain hobbies and things like that. So particularly, we're talking about high ticket things, maybe like dining out excessively, purchasing luxury items for 40 days. Okay, not forever, but for 40 days, this can be a great practice in financial discipline, self-control. And then talking about as a health benefit, we've been talking about giving up things for 30 days. At Ochsner and, in the health community, we know there are only benefits to quitting smoking. And just not even to mention how much money you would save. According to the American Lung Association, pack-a-day smokers would save between $1,400 and $2,500 annually, depending like on where you live. Heavier smokers, that would translate even to more savings. So that's a huge financial benefit. Quitting smoking, we have resources for that, of course. We'll get to those later, but and then I won't ask for people to disclose or self-volunteer, but I have this example I found on a banking website about the amount of money people statistically have spent on impulse shopping based on like targeted social media ads and things. But I was so surprised at the number. I think that's an average number, but either we all have or we know someone who has impulsively shopped from the ads or from the QVC or whatever it was. So I didn't want to leave off of this PowerPoint, off of this slide particularly, without sharing some things that you may want to do that are free things for overall health and wellness. Number one, drinking water. Number two, walking outside, sunlight. Of course, that is weather permitting, but walking inside, standing up at your desk, or taking a stretch break, those are free. So secondly, I'm sorry, third or next is just getting more sleep. I know that's a luxury sometimes based off of our family circumstances, our work, schedules and things, but getting more sleep, it would technically not cost very much or be free. And then lastly is just getting a library card. That's free. And you can even do it online. You don't have to go in person anymore to the libraries. But those are some things to do for free. There are so many financial benefits to taking a pause or giving yourself a break from something for 40 days. So did I miss anything or anything else you want to add that would be benefit, saving money, financial? All right, to wrap it up, then this is all meant to help develop healthier habits. Giving yourself time, reflecting what's important to you, improving your mental, your physical, and your financial well-being. These small changes, even if you're not going, like way extreme, okay? Arguably, that's not, the way to go, but small changes can have a profound impact on your life over this length of time. again, the context of this presentation is not giving up something necessarily forever, even though you may want to. We're talking about giving up something like for 40 days, okay? So this is the time where you could actually be a winner from being a quitter. So all of that to say, this is, we've talked about all the benefits, we've talked about the why, motivation, but what is the how? How do you do this? We're on day 1 here right now, but where's the easy button, right? And so I don't have an easy button to share, but I do have some health coaching top tier tips, and I want to share those with you all. There is a reason, unfortunately, that statistically 90% of New Year's resolutions fail by the second week of February. So this is what we're going to do. We're going to set you up for success today, and to get set up before we dive in any further to day 2, 3, and 4, let's start day 1 with a plan. So let's plan for success. Of course, the expression is true. If you fail to plan, then you plan to fail. So in the coaching world and in our habits, stacking habits world, we like to use something called SMART goals. And I'm going to break this down using an example, but if you have ever heard of a SMART goal before, you can put that in the chat. Or if you haven't heard of a SMART goal before, I'm happy to introduce this concept, okay? This goal is not just SMART, like a good idea. It actually is specific, measurable, attainable, relevant, and timely or time-bound. So using an example that we've kind of talked about or touched on a little bit is actually giving up alcohol for 40 days. What will that look like? How am I going to do that? Okay, I need to make a SMART goal. So my goal is that I'm going to replace alcohol drinks with a no calorie or sparkling water, diet soda for the 40 days. Okay, that's my goal. I'm going to give it up, but my plan is to get a replacement. Specifically, the S says that I know what I'm doing. Okay, that's a pretty specific goal. I know what I'm going to do. But how will I measure that? That's kind of a weird one. What's the marker? What's the measure of this? I could do something like a checklist, or I could do something like a calendar and give myself a sticker. But kind of logistically, I think I'll measure this by, number 1, stocking myself up, putting some of those good sparkling waters or diet sodas in the fridge, keeping them around, okay? And I'll measure this because I'll have those in the fridge. I'll have to rebuy them every week. So this goal is attainable. I know that I can do it. It's not something that is logistically, beyond my reach or control. And it is relevant to my overall goal of health improvement. I know that I'm going to be working toward optimal health by doing this. That's relevant to my overall goal of healthier living. And lastly is timely. I know that it's starting today on March 5th. I'm going to do this for 40 days. That is until Sunday, April 20th, which is Easter in 2025. So has anybody ever made a SMART goal before? If you have, you can put that in the chat. Definitely share that with me. And that's your plan. You're giving yourself a plan here. And a part of the plan always is to anticipate obstacles, because they are going to happen. It's not if, it's when. And so how are you going to approach that? What's the plan for obstacles? You have to plan for those. So thinking ahead, looking at your calendar, where may I be tempted, or where may there be a slip? For my example, it could be going to a birthday dinner or someone's wedding, something like that, a holiday. So there's obstacles. events I should be anticipating to make a plan for. And that could be a different plan based on where we are. And then lastly, as a part of your plan, it's important to have accountability. Number one, it's mostly important to be accountable to yourself and to be accountable to keep the promises, ultimately to keep the promises that you make yourself. But someone or something may make it easier to do that, easier to be accountable. But that's one thing too, put that in your plan. So no easy button, but we do have a plan. We have a SMART goal. Another key to helping you achieve your goal, to make it these 40 days, is to stay busy. Keep yourself occupied, okay? Find a healthy distraction. We're not saying to get into like another, an unhealthy distraction or an unhealthy habit. Okay, find a healthy distraction. I like the idea of volunteering your time. Okay, make a recurring volunteer appointment. Put yourself on the calendar somewhere that you are spending your time there and not, it's difficult to get out of, okay? Avoiding triggers. Again, you can plan ahead for some things, but you also could avoid some circumstances. And I think that this example that I thought about was not going to like the fast food or gas station convenience stores like on your way home. If you're tempted to maybe slide in there and get some fast food or junk food, just go a different route. Okay, go a different route home, go a different route to work. If you need to get gas, go to a gas station where there's not a convenience store attached. And lastly, of course, replace one habit with another. Okay, find a good, mutually beneficial swap there. I like these examples, like if you're giving up chocolate or sweets and sugar, then you may want to try brushing your teeth immediately after you eat. If you're tempted to want something sweet after you've finished a meal or had something healthy to eat, and you're like, okay, well, I ate something healthy, so I can have a sugar, I can have a sweet. Brush your teeth after. You may not want to do that as much. It could really take away the good flavor. Like if you're giving up alcohol, using your, if you want a fancy glass or something, putting your sparkling water or your diet soda, putting that in a fancy glass so that you're, you're still having fun with that, but staying on track. And then lastly, like having excessive cell phone usage, if that's something that happens for you, like in the evenings or late afternoons, you may want to book something that time block, like an exercise class or, the volunteer appointment, an exercise class, something that is difficult to get out of so that you have more accountability to do it. So any questions so far? Anything? I haven't paused in a minute. I'm going to practice my pause.
Well, we don't have any questions, but people, I want to thank everybody who's watching for being so chatty in the chat box. People are giving some really great tips, so I hope that everyone in the audience is looking at the chat as well, seeing what tips are being offered by the other viewers. I did want to point out a couple of things. Jordan says, removing or not saving your cards online helps to reduce spending since you have to go get your card to purchase. So that's an extra step that I guess Jordan uses to keep their spending down online. Sean says, life is short. Do whatever you want with your own money. Just have to be prepared to live with the consequences. YOLO. And Sean, of course, is right. You don't want to make yourself miserable, and you've made the money, so you spend it. But you just have to make sure you've got a good balance, right? And then some people have put up, like their SMART goals that they made, and then other people have, given some suggestions. For example, Allison says kiwi instead of ice cream. Dana says, if I'm hungry after dinner, I'll eat an apple if I get hungry before bed. Lori says, hey, Lori. Lori says, volunteering always. She signed up for a road race. But she eats pizza because it's all about balance.
There you go. And that's a huge part of this, right? We're talking about, giving things up. You're not going to have it for 40 days, but it really isn't supposed to be forever. It is just for a period of time. And that helps to learn that balance. It helps to support that balance out into the future. Like Jordan said about not saving the cards online, I have this is my health coach golden knowledge here is the 4 Ds to help you stay on track when you have a health goal or you have a financial goal or you have a, well-being goal. I like these 4 Ds, and they are to delay, distract, disguise, and distance yourself from the temptation. Okay. So delaying gratification, setting a timer, delaying, saying, okay, I can have, this is my money. I made this money. I can have this item or this thing, whatever it is. I can have it, just maybe not right now. I'm going to give myself a week. If I still want it in a week. Has anybody ever put something before in their shopping cart but you just didn't press checkout? That's kind of what I'm talking about here. Okay. Delaying if you want to have some chocolate or something sweet. Give yourself a timer. Maybe start with like 15 minutes and see, okay, if I still want this in 15 minutes, then I can have it or whatever. But really, we're talking about delaying here for the 40 days. You can, add those things to your shopping cart and just don't check it out yet. Of course, there are things you would want to maybe delay forever, but this is just for today. We're talking about for Lent. Okay. Next is to distract. Give yourself a distraction. We just talked about that on the previous slide, but doing something to actually like physically occupy your hands and occupy your mind. So that's something that a lot of people do. If they're trying to give up like unhealthy snacking in the car, chewing gum, or singing to the radio, or if you're at home and we're trying to give up, excessive social media use, then doing something like a coloring book or reading, a book or a story, maybe even one that you've read before, but you want to reread, something that's going to give you a good distraction. If that doesn't work, then we're going to move on to a disguise. I say disguise is out of mind, out of sight. Okay. Make these things unrecognizable to you. Put it in a place or put it into something, whatever it is that you don't need, that you're not going to be reminded of. Get rid of the cues, whatever the cues are to cue, not exercising. Put your shoes in your car instead. Give yourself a disguise, okay? But lastly is the distance. Distance yourself physically. Don't bring the unhealthy snacks in the house. Do a purge tonight when you get home. Physically take away whatever it is. Put your phone in another room while you're working, or put your phone in another room while you're talking to someone. You're talking to your spouse or your partner, your children, taking away those distractions by distancing yourself from them. That would also be like not putting your credit card info to the websites. You're giving yourself a little distance there. So we've talked about making a plan, keeping yourself busy, okay? And then the health coach 4Ds to stay on track with your goals for Lent. But lastly, this is really important, and it is talking to someone who is a professional. There are so many resources from Ochsner. If you want, not even if you like need help, if you just want help, ask for support if you want it. And there's so many wonderful Ochsner resources. These are listed here. The Office of Professional Wellbeing, I know they've even done some expansion recently, expanding their offerings, the Employee Assistance Program, so many things under their umbrella. And then more specific things are like the Alcohol Free for 40 challenge that actually started today. We were so bummed that the deadline for that registration has passed, but they have awesome resources and they do it every single year. Then the smoking cessation program, that is a wonderful, wonderful program. Again, we want to promote not smoking forever, but if you have to try, let's try for 40 days first. And then lastly is joining digital medicine. So there are a lot of people out there who may mean well and have best intentions. So be really careful who you take advice or listen to, but seeking the help of a qualified professional, like any of these folks listed, is another guaranteed way to be successful. Again, looking ahead at where you are, looking where you are right now, and then ahead into 40 days. What's going to be different and what's going to be the same. Okay. But ultimately, I know that you guys got this. This is just a temporary sacrifice for potentially a long-term payoff, a really great reward, that sense of accomplishment that you're looking for, remembering all of the benefits we talked about right at the beginning. I know that you got this. So I appreciate you staying on and hanging out for this part of my presentation. I'll go ahead and break here in case if there are any questions before we go on to talk about digital medicine, who is promoting this today. Anything?
We actually just only have one question. Candace asked if we could explain the disguise part again.
Yeah.
And then after that, we'll go right into digital medicine because we have been talking too much and we're running out of time. So
Yeah, we are. Just to give a little bit more, let me give an example of a disguise. So I'm thinking about if I have, say I want to give up sweets, okay? I'm going to take my new unopened box of Oreos that I know they're probably going to be good in like 40 days or so. I'm going to put those Oreos in a non-see-through and opaque Tupperware box, like a shoe box. Put them into something and put them away. Okay. That way I'm not seeing it. I don't remember what it is. I don't know what it is or where I put it there. That's what I mean by a disguise. If you have something like if you're trying to give up alcohol, put your alcohol in a different cabinet where you're not going to remember or be cued or be notified that, oh, that's where, you know, my alcohol is. So now I want it because I see it and it's there. It's not there. I put it somewhere. I'm just disguising it for like 40 days. So I hope that example helps. And if that doesn't work for you, then give yourself more distance, give yourself a delay using a timer, reminding yourself it's only for 40 days, or a healthy distraction. Okay, so I am going to go ahead and jump on now to talk about digital medicine. If you are not familiar or already informed about what it is, this is a gem that Ochsner has. So a digital medicine, like I mentioned, I've been a coach for 4 years. This is a totally remote program that's proven to manage your chronic conditions, which are, we're going to talk about later, but this is from anywhere. This is not going in to see your primary care doctor or a visit every 3 months. This is somebody that you have access to. So benefits here, of course, simple to use devices, support with your medications and lifestyle, and our proven results. And this is how the program works. For eligible and qualifying members, you would take your readings from home, the comfort of your own home, not going into an appointment for that, then getting treatment and medication management from a licensed clinician, also lifestyle support from a health coach like me, and something that is able to share your results, share your progress. It's all housed in our own exclusive digital medicine app. The statistics speak for themselves. 4 out of 5 members reach their goals in 6 months. The care team that we've talked a little bit about, it's a licensed clinician. This is a doctorate level pharmacist or physician's assistant who has a residency in patient care. They are medication management experts, and this is what they do. They are the experts in blood sugar, blood pressure, hyperlipidemia, and obesity management. Next, of course, is the health coaches, registered dietitians. So we have a very diverse group, but we are all trained in behavioral counseling, habit changing, and growth. So that's who you get to work with in the programs. We have tech support that is dedicated to digital medicine. So you're calling someone in the Ochsner family when you have questions or need a little troubleshooting. Our proven results, again, these are high numbers and they speak for themselves. Even the fewer ER visits are just super impressive. So I don't know anybody who is not trying to lower their chances or risk for being in the emergency department. So again, this is all about you and your care, customizing this to you. This is your health and your experience, okay? We have patient testimonials. We have patient clinician relationships. You're working with someone who knows your name, who is assigned to work with you, somebody who you would know when you call them up, and then somebody who's just available. So there are perks for being in digital medicine. If you are an Ochsner employee, which I think we all are, okay, for the OSH plan members, this is a free program to you. If you're eligible and you apply, this is, not just a free program, but again, you have so much to gain from doing it. And not to mention too, like your Personify points, which I know a lot of you are excited to get those today. So lastly, I do know we're talking about digital medicine. Who is it for? Again, you do have to have a qualifying condition. And so that may not be everybody, but if it is, we want you in digital medicine. We want you to get that customized care that you should have. So I'll put this up. This questions is for digital medicine, but any questions that I missed in the chat?
Sorry, trying to get off of my.
Anything I missed in the chat?
I don't actually see any questions in the chat. I do see one question in the Q&A, which is about getting the pathway to wellness points for the weight loss part of digital medicine. I can answer that. As far as I know, you do not get the pathway to wellness points for the weight loss. If you are in the high blood pressure and the type 2 diabetes, you will get pathway to wellness points. However, I know that in pathway to wellness, there are points available for like if you lose a certain percentage of your weight. So even though you don't get it for digital medicine per se, by virtue of being in the program, there's probably points you could get in other avenues of pathway to wellness, if that makes any sense. Let's see. So answered that one. Yeah. And it does not appear that we actually have any more questions. But yeah, if anyone's interested in that, in the digital medicine program, you can scan the QR code and that'll bring you to the sign-in sheet. And I personally want to thank all of our attendees for being so active in the chat. You have given us a lot to talk about, and you've given your fellow attendees, points to consider. So I appreciate that. So Alicia, anything?
Thank you so much. That's it. Thank you guys so much for attending. And it was a pleasure to be here. Thank you, Jess, for your facilitation. Couldn't have done this without you too. So thank you. And
sure.
Hope to see everybody 40 days from now, feeling good, looking good, living their best lives. So definitely the best is yet to come.
All right. Scrolling to see. No, everybody's just saying thank you. So, okay, I think we can go ahead and, oh, wait, what's this one? Nope, that's a thank you. Okay, just kidding. All right, I think we'll go ahead and sign off now. Thanks so much, Alicia. Thanks, everybody, for attending.
Bye. Thank you.
Bye.